Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today we're here to talk about sports and energy drinks.
Sports drinks like Gatorade or Powerade or Propel, they contain sugars or carbohydrates, they contain salt, and they contain electrolytes or minerals. The goal of the sports drinks is to replace the losses that you have during really vigorous exercise. So with the energy drinks, the biggest difference is they contain large amounts of caffeine.
Should kids consume energy drinks before and or after sports?
The answer to that is no. The American Academy of Pediatrics has said that children and adolescents should avoid energy drinks really at all times because of the potential harms or hazards associated with caffeine. Instead, if there is rigorous, high-level exercise, if the kids are really working hard out in the heat, then that would be the right time for a sports drink. But at all other times, or really even in those scenarios, water is the preferred method of rehydration. We see kids for things like anxiety, we've seen kids for panic attacks, but in the more serious cases, we can see abnormal heart rhythms or dysrhythmias. Parents might see things like insomnia, irritability, decreased concentration, daytime drowsiness.